Hello, this is Dr. Eric Rosenberger at Facial Focus Cosmetic Surgery. Today we're going to be demonstrating Kybella injection. We have a patient who has had an initial treatment with 2.5 ml of Kybella to the submental region. You can now see the initial pre and then the 2-month post-op with a significant reduction in submental fat. This patient would like a little additional tightening of the skin in the submental region. So next what we're going to do is we're going to mark out surgical landmarks, being the mandible, the thyroid cartilage, and then delineating the region that we're going to address today. And then we'll be applying a template. So marked out the angle of the mandible, the body of the mandible. We marked the pre-jowl sulcus. We had the patient bite down for me. Can't see it very well, but right here you can feel the edge of the masseter. The facial artery and vein run with the marginal mandibular branch of the facial nerve. It's going to be coming down, looping underneath the mandible, coming across the mandible, somewhere in this region, and that's why I marked out the jowl in white. This is an off-label area. Your risk of a marginal mandibular nerve palsy increases with injection here. Pre-jowl sulcus continues. You don't want to create a depression. You usually have this pre-jowl sulcus continue to the mandible, so if you're trying to make a nice mandibular contour, you'd want to avoid making this a depression and instead focus on pulling in the jawline here. We've marked the midline, inferior border of the mandible. We've marked the hyoid bone. We've marked the thyroid cartilage notch. There's no advantage to injecting in this region down here. So the supplied grid pattern that comes with the Kybella has been applied. It's a series of these multicolored dots that are spaced 1 centimeter square, and there are 30 of them total that I'm going to use. I have made a kind of jigsaw pattern with my wax pencil to kind of feather where these injections are going to go. Anything that's within the sawtooth I'm actually not going to use, and then I penciled in a few areas where the dot didn't quite stick, and that's actually going to be right here in the jowl region here and here. She's got a little bit of a depression right here. I'm not going to use this dot, and I'm not going to use this dot at the border of the inferior border of the mandible, but we're going to use the rest of these in here. The order of events is basically going to be 0.2 of a cc is going to go at each dot. We move quickly, and then we apply ice as soon as we complete the injections. What we're going to do to ensure that we're in the right plane is we're going to grab the tissue, go ahead and grimace, make sure that there's no muscle in there, and we're going to go ahead and get started. We've got our syringe ready to go, and we're gonna get started here. So 0.2. 0.2. The conclusion of the procedure, the patient has been cleaned, and obviously all the marks are gone. You can see that there is a line of erythema in the submental region. You really can't appreciate the swelling, but I promise you that tomorrow it will be significant. But overall, relatively bloodless. Can you describe your discomfort now? 0 to 10?
Oh gosh, maybe 2 at this point. It just is a little bit of a warm ache, and the ice packs pretty much take care of it.
Nice.
It's not bad.
Great. Okay, well that's it. So this is a lateral view of our patient after 4 days following injection with Kybella. You can see as we zoom in here that there is still significant fullness in the submental region. This is the anticipated result that we will be getting. So all this is just kind of full and is continuing to resorb essentially. Could you give us a little overview of the past 4 days as far as healing and swelling, pain, etc.?
Sure. So after the procedure, I had a significant amount of redness, and I would say at that point about pain went from 2 to about a 6 over about the next hour, and I treated that with ice, which helped a lot. The next day it was red, just slightly, and kind of tense feeling. It was a good day to wear a pretty scarf, but not painful anymore. Certainly no problem swallowing or talking. I went to work that day, and the next 2 days it became more soft and kind of gel-like. So it's a fullness that I notice, but someone who doesn't know me or even my coworkers don't really notice it being out of the ordinary.